Doctors of Reddit. What one medical fact do you wish everybody knew? Story 1. Your immune system is one of the greatest assets you have, and you never thank it. In your life, your body will autonomously eradicate between 6 and 10 cancers without you realizing. It will fight your infections, repair micro traumas, and police the entire population of billions of cells in your body without your asking. All it requests in return is a little bit of health to preserve it. Stop smoking, lose weight, maybe exercise a little. Don't drink so much. Your diet is so much more important that you realize. Story 2. Nurse here. If you're an alcoholic that's admitted to the hospital, don't lie about how much you drink. There are drugs we can give you to take the edge off of withdrawals. It's safer for you and safer for us. We're not judging you, we have safety in mind. When I was on my pharmacy rotations, I remember a guy in the ICU for alcohol withdrawal. He was having such strong tremors that even benzodiazepines couldn't stop. He was there for a whole week. At that point, I promised myself not to have more than 2 beers at a time. Story 3. Viral infections cannot be treated with antibiotics. I remember going to the doc with a viral infection once. I had never felt that horrible in my life, and I routinely get sinus infections. I felt so awful. I tried calling people to take me to the doc so I wouldn't have to drive, which I've never done before. Sadly, all my friends work in the middle of the day, and my mother was out of town. I drag my sorry butt into the doctor's office. He pokes me, looks at me, and tells me to go home, sleep it off, and I'll feel better in 24 to 48 hours. I begged him to give me something to make me feel better, and antibiotics have always worked. He tells me I have no sinus infection and to sleep it off. I leave extremely pissed, barely make it back home, collapse on the sofa in the living room, because that's all the energy I have at the moment, and pass out. 24 to 48 hours later, I was feeling a whole lot better. Story 4. Smoking will end you. Nah, cancer won't get to me, you might say. And you'd be statistically right. It'll be your heart. In the simplest of terms, smoking makes your arteries rigid, so as they progressively get filled with fat. Instead of increasing their diameter, they'll just get stuffed until no more blood can get through and you'll be done. If you're lucky, you'll get some chest pains beforehand, but that's not always the case. Joke's on you, sucker! I got a heart attack and survived. Death ain't got crap on me. Welcome to the world of chronic heart failure, where from now on, every day that goes by, your heart will be less a pump and more a container, until you get out of breath from just speaking and eventually die. There's no going back. Please, stop smoking. Story 5. Volunteer SAR ship crew member here. When you suspect whoever is lying down is not breathing by themselves, begin CPR immediately, and do not stop until a medical professional arrives, even if this means that you have to go on for several hours. We do not perform CPR to have the patient miraculously wake up and make out with us. We do this to sustain the most vital bodily function, the circulation of oxygen to the brain, until we can get that person to a hospital. Story 6. Nurse and midwife here. I wish people understood that if they are receiving treatment for a condition, they still have that condition. Case in point, if you're taking medication for something, you aren't suddenly free of that disease. Your blood pressure meds are maintaining a normal blood pressure because you have the condition of high blood pressure. Your insulin is maintaining your blood sugars because you have diabetes. Sounds simple, but amazing how much people tell us they have no conditions but are on 1,000 medications that tell a different story. Story 7. Not a doctor, but something a doctor told me when the incident occurred. Girls, if you get excruciating cramps at the time of your period and it feels much worse than it actually is, go to a doctor. When I was 13, I had already been confirmed to have an ovarian cyst, and it made it very painful for me during my periods to the point where I had passed out from the pain of it once. However, at one point, it felt much worse than it typically did, and I blew it off as being because of my period. It turned out my appendix was bursting. The doctor told me a lot of women blow off period cramps because doctors tend to do the same. It almost meant life or death for me. Story 8. Vet tech. Your cat is probably obese. So many people freely choose their cats because it's easier or just way overfeed their cats because cats whine a lot. You're not doing your cat any favors. He's going to get diabetes. I'd guess that about 10% of cats I've seen are actually at a healthy weight. Get a good wand toy and play with your cat every day, and for God's sake, limit how much they eat. Also, treats are supposed to be less than 10% of your pet's caloric intake. Cool it with the treats. Story 9, doctor here. Don't stop your medications by yourself. Just don't, no matter how good you feel. Patients stop antibiotics and relapse. So many resistant TB cases here. Stop taking insulin and come with DKA. Stop taking antihypertensives and get a stroke. Don't stop any drug unless cleared prior with your doctor. Most of the diseases can only be managed. They can't really be cured. If you have diabetes, get sugar levels tested at least once a month. Don't ignore it. Don't mix alcohol and antidepressants. Also, no matter how bad it is, we have seen worse. Don't be ashamed. Pulling out doesn't mean she won't get pregnant. Precum has sperm, too. Last, if you see anyone vomiting and lost conscious, turn them to their side. Less chances of it entering lungs. Story 10. I may be alone in this, but I want my patients to know that there is no possible way I can keep up with all the medical advances and new studies that are out there. And I also want them to know that there are thousands of conditions that I learned about in medical school that I've forgotten because I've never seen or recognized them in practice. This is important because my patients frequently apologize for looking up things on the internet. No, don't apologize. I want you to research your condition. I want you to look things up. I want you to know about new treatments, new research, and alternative medications. Because often I don't. I may not agree with the things you've read, and that's fine too. Ask me about things you've read in the picture you found that looks like your rash. I can't tell you how many times a patient has come to me with a suggestion about a possible explanation for symptoms because they read about it on the internet that turned out to be a correct or at least reasonable guess. Please educate ourselves about ourselves. Story 11. Clinical psychologist here. If you need mental health treatment, try your local college campuses. Oftentimes, there are training clinics, supervised by some of the best clinicians around. Most will provide a generous sliding fee scale. Treatment works especially for sleep problems, depression, anxiety, PTSD, etc. Also, do not ignore mental health problems in your children or adolescents, including when you are concerned about substance use. Early intervention works best, and if you wait until they are 18, they may not get treatment for another decade because they refuse to go in until they mature in their late 20s. So, if your child or adolescent is showing signs of a mood or anxiety disorder, cutting, struggling with ADHD, and is using drugs regularly, weekly or more, and you are concerned, consider an intake assessment with a licensed psychologist. Story 12. Former EMS here. Don't get angry when that quiet person gets taken out of the ER waiting room before you. You have a headache and are raging, and I can't help you. But that person who just got taken back is quiet for a reason. You're not dying. Death is quiet. I can't tell you how many times I took someone to the ER yelling and kicking and screaming, and when we roll up and they get looked at, it's often minor. I've seen people who I had a feeling would not make it. They don't rave like idiots, they lay still and quiet, and it's almost eerie. Story 13. If you want to keep hands and fingers and upper limbs intact, do not punch a wall or car door, or a guy in the face or brick, etc. You will end up with a boxer's fracture or a break of your fifth metacarpal bone. Most of the time, everyone will know you were drunk when it happened, and it's not comfortable or fun. Do not reach into the chute of a running snowblower, even if it's stopped because something is stuck in there. Do not attempt to fix your chain-driven garage door opener by putting your fingers in the track and asking your wife to hit the button. Do not reach into an auger at work trying to retrieve your safety glove that just fell in there. Do not hold on to something at work that winches rope. If you have a wound on your hand/fingers/arm and it is oozing something that looks green, yellow, white, or pink, go to the doctor and have it looked at. You may save yourself from an amputation. Source: I'm an RN at an orthopedic surgery center. All of these things have happened numerous times. And yes, archaic as it seems, sometimes people have to get fingers or even hands amputated in this day and age because they ignored an infection. Story 14. Australian paramedic intern here. We are not the police, and we really honestly don't care about any of the crap, illegal or not, you have done or taken. We just need the full story to make sure that you can get the best targeted treatment. Also, we don't mind getting called to old people falling and not being able to get up, especially if they have no family or no way to contact them. For me, that's a medical emergency, because if you stay there, you will die. And paramedic school taught me that that is bad for you. Story 15. Oh, yes, we will always be there and will always, by law, take all comers. However, just as you don't go to a cardiologist for foot pain, don't seek care from an emergency medicine physician for your non emergency. We are highly trained in true emergency situations. It's what we love. However, once it has been assessed, you don't have an emergency. You get our best educated diagnoses, which may fall short of the true diagnosis and treatment regimen because we don't have the tools or time to fully work up every complaint. Story 16. Please go get your yearly blood checkup done. 2 tubes of blood will tell you so much about your health. It is way easier to treat conditions early than later on. My grandma let her chronic leukemia get way out of hand before going to her doctor about it. If she'd had yearly checkups, she'd probably have found it much earlier on and not had to have quite the intensive buy of chemo she had to have. She's fine now, but I'm still annoyed she never went to her doctor earlier until she was really sick. Story 17. Losing weight when you didn't really try to lose weight is cancer until proven otherwise. People ignore this sign so often, and when we finally make a diagnosis, it turns out they noticed the weight loss months ago and could have been picked up earlier. If you lose more than 5% of your body weight and didn't try, see a doctor, even if you're young. Make an advanced healthcare directive. I work in the ICU. We can essentially keep you alive on life support indefinitely as a vegetable. Nobody wants that to happen to them, so make sure it doesn't happen to you. At some point in your life, you'll probably have a colonoscopy. Most people have one. Nobody admits they had it. Don't be embarrassed by it. Don't smoke, eat crap, drink alcohol, skip exercise, never go outside, binge TV, but just don't smoke. People always talk about lung cancer as the reason not to, but YouTube's COPD. The ones who don't die of lung cancer die a slow and drawn out death where they essentially get more and more breathless over about 10 years. It's horrible, and unlike lung cancer, is near guaranteed to happen to lifelong smokers. If I was a smoker, I'd rather get lung cancer and die quickly than face COPD. Story 18. Former combat medic with the Army. Don't wait to get treatment. Rarely will it just go away or get better. I can't count how many times I'd do primary evaluation of a patient who came into sick call in the morning with some sort of ailment, and when I'd ask how long they experienced the symptoms, I'd get a response like, oh, maybe a month. A month? That's no longer an illness. That's a condition. Remember, the older you are, the less likely you are to bounce back from an injury or illness, and not getting it taken care of right away can end up making it a lot more difficult to treat and recover from. And practically speaking, getting something cared for immediately means that you're going to suffer for a lot less time. Story 19. Not a doctor, health economist. People need to know what opportunity cost is. If you have a treatment, someone else can't. Every healthcare system is overburdened in some way, and all resources are finite. If your doctor says you need to exercise, eat healthy, and take statins, do it. Having a stroke or myocardial infarction doesn't just suck for you. It also sucks for the person who needed the ambulance too, but hadn't been given the necessary drugs and lifestyle advice to prevent an assault or car accident. If you can take steps to prevent something, do it, because it's not just your own life you're saving. Story 20. Don't ask for or take if in your country it's sold over the counter for antibiotics when you have a common cold. Not only does it not help, you are also contributing to the spread of multi-resistant bacteria. Background. Firstly, a common cold is defined by a running nose, clear, not putrid, fever, general feeling of being unwell, a sore throat, and/or coughing. You don't have to have all of these symptoms, but all can occur. It is usually self-limiting and a viral infection. Antibiotics work against bacteria, so there's nothing to win here. The indiscriminate ending of potentially beneficial bacteria by antibiotics helps selecting the strongest, which may be those with resistance mechanisms that can bite you or someone else in the ass later. If you are not in an ATE risk population, under 65, not immunocompromised, no chronic heart or pulmonary conditions, you'll get over it by just taking it slow for a few days and keeping hydrated. The latter is most important. Only if breathing becomes painful or symptoms get worse after a few days, antibiotics may be called for, but so would be blood work or maybe an x-ray. So you should see a doctor before starting to take it. Story 21. Good health has very little to do with doctors. 90% of health, or not, is related to lifestyle. The other 10% is luck. Doctors are great at dealing with the fallout and picking up the pieces, but better to try to avoid needing us in the first place. Doctors and patients tend to grossly overestimate the benefits of medication and underestimate the importance of lifestyle. Boring but simple. Exercise, eat well, don't smoke or drink alcohol in excess. If everyone did this, we'd need far fewer doctors. There are factors that affect people's ability to make healthy choices: advertising, taxes, income distribution, green spaces, childhood development. That's why it is important to advocate to policymakers across government departments to work together to tackle public health problems. Solutions are not found in silos, nor are they found in your doctor's office. Story 22. Late to the game doctor here. For many pain complaints, there are frequent associations that will help the doctor figure out the diagnosis. Most of clinical medicine comes from the history, followed by physical, and then labs and imaging. Did anything else happen at the same time as the pain? Diarrhea, new medication, started a new diet, changed shoes, another menstruating girl moved in with you, got proportionately worse as you gained weight, worse towards the end of day, black cats following you around? I will sometimes ask this to get my patients to think broadly. Write down when everything happened and the order everything happened. Things that have been going on for a while beforehand are unlikely to be associated. New things have more clinical importance. Help with your doctor's history taking. It will help you back. A good clinician can get you an answer without expensive tests. Also, don't smoke. Seriously, stop now. Story 23. Periodontitis, gingivitis, and dental caries, cavities, are bacterial diseases that can be contagious. Oral health is part of overall health. Seriously, if you have diabetes and/or heart disease, take care of your gums. Really, everyone needs to floss. It is far cheaper and less painful to adequately maintain good oral hygiene and regular cleanings than to not do so. If you can't afford regular cleanings, find a dental hygiene school nearby. My school only charged $10 for a cleaning, and that included x-rays, local anesthesia if needed, the cleaning, fluoride treatment, and a cancer screening. Dentists and dental hygienists don't poke you, causing the bleeding. We spend months learning angulation and adaptation of our instruments before actually seeing patients, so as to not cause trauma to your gums. Story 24. Not a doctor or medical professional, but just wanted to let everyone know that there is a pretty rare condition known as methemoglobinemia. This happens when a person has ferric iron in their blood instead of ferrous iron. If you are given any type of numbing medicine such as lidocaine, benzocaine, etc., the ingredients in it somehow attack the blood cells, taking the oxygen out of them. I don't know exactly how this goes, so you can search for methemoglobinemia. It can be very serious and cause death quickly. It's pretty rare, and doctors and dentists don't usually know about it. Babies have died using Oragel, and patients have sometimes been given the wrong cause of death because the doctor didn't know the patient was allergic to the numbing medicine. Story 25. You don't need an MRI, or maybe you do, but I'll decide that. MRI is a tool, just like lab work, other radiography, etc. Getting an MRI does not fix your problem. Diagnostic, not therapeutic. You would be astounded by the false positive rate MRIs have. So just getting one for any old reason creates more questions than solutions. Here's how it works. You have a problem. I know a lot of problems with certain anatomy and what is normal or abnormal. I do not know everything. Using what you can tell me you are experiencing, I will decide if different studies are needed to help define what exactly the problem is. If it's not needed, we can proceed with treatment. Don't just show up because your back hurts for a week and needs an MRI. By the way, back pain causes muscles, and an MRI doesn't show that. Even PCPs and people who don't evaluate it regularly don't realize this. Discogenic back pain is highly debated, but most spine surgeons don't believe it's a thing. That disc popping out isn't the source of the pain. Nerve compression is, and it's the cause of weakness or numbness down the legs. So frustrating. Honestly, twice the time is spent explaining why you don't need this $2,000 study you want. Because you don't know any better than just explaining what actually is going on and what our treatment options are. Story 26. I am not a medical professional, but I work in healthcare, have a psychology degree, and have experienced depression and anxiety most of my life. I wish people would stop comparing clinical depression and anxiety to everyday depression and anxiety. Clinical depression and anxiety affect your functioning in everyday life and come with some physical symptoms as well. Also, you can have severe withdrawal symptoms from antidepressants and benzos if you take them for a long time. You can die from benzo withdrawal by having a seizure. I was on clonazepam for 3 years, and my bottle disappeared. I don't know if I lost it or if it was stolen. I did not fill out a police report. I told my doctor at the time about it, and she refused to fill it and told me I could not have withdrawals from it. At that point, I had taken it for over 2 years every day and was up to almost 3 milligrams a day. I never saw that doctor again. Story 27. You should not sleep off a significant head injury until you've seen a doctor and he's told you can. Last time I was in a medical askreddit, there were hundreds of people talking about how they didn't go to see a doctor when they started to feel very sleepy right after a head injury. Folks, it could just be a concussion, or it could be an epidural hematoma, in which case you won't ever be waking up from your nap. I've had two significant concussions in as many years. Actually, the worst one is shy of its 3-year anniversary, and I've had to become well versed in head trauma because of it. The more recent one came from being hit in the eye socket with a softball. Me, being the arrogant one I am on the field, decided to tape it closed and keep playing. However, I took time to sit, get asked a few questions, and observe how my body felt. I left as soon as I felt like vomiting and drove straight to the hospital, while on the phone with a firefighter friend. 6 stitches and a whole lot more exacerbated concussion symptoms later. I had a beautiful black eye for a few weeks. Always get checked out. I was fortunate both times to have only received concussions and not brain bleeds. Story 28. No one is claiming Western or modern medicine is perfect or has all the answers. On the contrary, there is so much we don't know, and treatments we wish we had. However, it is still the system of medicine with the largest evidence base. Most of the treatments stand up to thorough, double-blind, randomized controlled trials, and thus the best we have. Just because it doesn't have every answer doesn't mean that it should be disregarded in favor of alternative or complementary therapies. There is no evidence the vast majority of these work. Many are dangerous, and most are trying to scam you out of money. They don't stand up to robust trials of any kind, let alone RCTs. People who take advantage of those who are sick and desperate by charging them, often huge amounts, for treatments that have no evidence to suggest they work are, in my books, lacking in morality and basic human decency. I have seen patients turn down cancer treatment because they've been convinced an alternative therapist can cure them, return to modern medicine riddled with cancer, and too late to do anything but help them die as comfortably as possible. All because an evil charlatan profited off their fear and lack of understanding. A senior once said to me, "The two things we know we can cure for sure in medicine are bone fractures and infections. It's no coincidence that alternative medicine doesn't offer to cure either of these things. We know exactly what a cure for these problems looks like, and they cannot claim their medicine can achieve this, because it can't."